So today is the officially first class, but we will continue with the understanding of pharynx, because pharynx is something which is a very basic part of the throat. When we talk of throat, pharynx is very important to understand at ENT, in the throat point in ENT. Besides, quite a lot of MCQs have been asked from pharynx in NEET exams. So it is important to know in detail about pharynx. Just a recap of the previous class. Just a recap of the previous class. In the previous class, we understood that pharynx is a fibromuscular tube which is extending from skull base up to C6 cervical vertebrae. Can I have one or two answers? What is the length of pharynx? Can I have one or two people answering what is the length of pharynx? Okay. Somebody is saying 10 centimeter. Any other answer they want to give? 12 centimeter, 12 centimeter. Yes, good. So fine. So the correct, both 10 and 12 both are correct. The extent of the pharynx from skull base to C6 cervical vertebrae is 10 centimeter to 12 centimeter. Some books mention 10, some books mention 12, but if 10 and 12 both are given in the option, write 12 centimeter. However, if there is just one option, 10 also is the correct answer. So 10 to 12 centimeter long is pharynx. I'll be going slightly faster because we had covered all this in the last class. This pharynx is divided into three parts. The part behind the nose is called as nasopharynx. The part behind the oral cavity is called as oropharynx. The part behind the larynx is called as laryngopharynx. So we have pharynx which is divided into three parts: nasopharynx, oropharynx, hypopharynx. I would like to refer to a diagram by one of my friend who is also ENT surgeon, Dr. Vijaya Govindarajan. He has made a very good book, a line diagram. I'm not sure if all of you can see this. Yeah, the video is clear. So this, imagine as the nose. This is the green color is the nose. The part of pharynx behind the nose is nasopharynx. Now below the nose is oral cavity. This is a good line diagram to understand this. So we have nasal cavity, oral cavity, and behind the nose we have nasopharynx. Behind the oral cavity we have oropharynx. Again, nose, oral cavity, and larynx. Behind the nose is nasopharynx. Behind the oral cavity is oropharynx, and behind the larynx will be the hypopharynx. So we have the entire pharynx, which is from skull base up to C6 cervical vertebrae. The part behind the nose, nasopharynx, behind the oral cavity, oropharynx, and the part behind the larynx is laryngopharynx. So this is a line diagram which gives us a clear idea about the pharynx, that is nasopharynx, oropharynx, hypopharynx. I again give credit to Dr. Vijay Govindarajan, who has given very good line diagrams. Okay, now as we understand the pharynx, we also understood that it is made up of 4 layers from inside to outside. The innermost layer was the mucosa, then there was a buccopharyngeal fascia, then there was muscle layer, and then there was anything wrong which I said. Anybody wants to correct? I said mucosa, buccopharyngeal fascia, muscle, and one more layer. Yes, so the second layer is not the buccopharyngeal fascia. The innermost layer is the mucosa. The second layer is the pharyngobasilar fascia. The third layer is the muscle layer, and the buccopharyngeal fascia is the outermost layer. Buccopharyngeal fascia is the outermost layer. Yes, I'm getting the answers. Second, then so mucosa, the pharyngobasilar fascia, muscle layer, and there was the buccopharyngeal fascia. The muscle layer, lot of MCQs from the muscle layer. The muscle layer has got circular fibers and longitudinal fibers. We had discussed this in detail, so I'm going fast. The muscle layer has got circular fibers and longitudinal fibers. The circular fibers are three: superior constrictor, middle constrictor, and the inferior constrictor. So we have superior constrictor, middle constrictor, inferior constrictor, and the vertical fibers or the longitudinal fibers are three. These fibers, they end with the name pharyngeus. So there is one from the styloid process, that is stylopharyngeus. The part coming from the eustachian tube is the anybody part coming from the eustachian tube is, come on guys, keep giving some answers. Which are the three longitudinal muscles of pharynx? Yes, one more name. Guluk is saying salpingopharyngeus, which is correct. Yes, Shreya also said right. Good. So we are getting the answers. Fine. So I believe you are getting my relay properly. So there were three longitudinal muscles: the salpingopharyngeus, the stylopharyngeus, and the palatopharyngeus. Great. So we have salpingopharyngeus, palatopharyngeus, and the stylopharyngeus. One important MCQ: all the muscles of pharynx are supplied by pharyngeal plexus. All the muscles of pharynx are supplied by pharyngeal plexus except which one? All the muscles of pharynx are supplied by pharyngeal plexus except. Great. We got first two answers from Adi, Palvi, and Navya. It is stylopharyngeus. Yes. So stylopharyngeus is a stylish muscle. It does not take the supply from the pharyngeal plexus. Okay, fine. Stylopharyngeus is the muscle which does not take the supply from the pharyngeal plexus. It gets nerve supply from the ninth nerve, that is the glossopharyngeal nerve. So stylopharyngeus, so all the muscles of pharynx are supplied by the pharyngeal plexus except the stylopharyngeus. Now understand. We have superior constrictor, middle constrictor, inferior constrictor. Now there is some space above the superior constrictor. This and this skull base, the space between the superior constrictor and the skull base is called as is given a name. This name is, what is this name of this space? Above the superior constrictor is a space. This space is given a name. This name is, yes, Yash has answered right. Morgagni. Gopinath, no, it's not Killian's dehiscence. It is the sinus of Morgagni. It is sinus of Morgagni which is above the superior constrictor. The sinus of Morgagni is above the. Yeah, we're getting but many answers now. The sinus of Morgagni is the space above the superior constrictor. Gopinath gave an answer that it is the Killian's dehiscence. Remember, Killian's dehiscence is a space between the two layers of inferior constrictor. So we have superior constrictor, middle constrictor, and the inferior constrictor. The inferior constrictor is divided into two parts: horizontal fibers and the oblique fibers. And between the horizontal and the oblique fibers is a potential space. This space, as Gopinath had given answer, was the Killian's dehiscence. So we have sinus of Morgagni above and Killian's dehiscence. There is one more space that we had mentioned last time, which is below the inferior constrictor, which is very less known. Not many people are aware. What is the space below the inferior constrictor? The space below the inferior constrictor. Yes, we got Vaishnavi, Shreya answering Heckermann, linear Heckermann. Yes, so it is Leimer. It is Leimer-Heckermann space. It is Leimer-Heckermann space is the space below the inferior constrictor. So three spaces are important. One is sinus of Morgagni above the superior constrictor, Killian's dehiscence between the horizontal and the oblique fibers of inferior constrictor, and between the inferior constrictor and the esophagus is Leimer-Heckermann space. All this, the Killian's and the Leimer-Heckermann space are the potential weak space. Potentially weak space, the importance is, while the applied importance is while doing esophagoscopy. When the anti-surgeon does the esophagoscopy, there is a possibility that there can be a protrusion, there can be a perforation in this part. So whenever the perforation happens, it can be a dangerous or fatal thing. So this idea of this space is important. Okay. We have circular muscles, we have longitudinal muscles, we should know about sinus of Morgagni, we should know about Killian stations, we should know about Lyman internal space. Now, one more question. In the sinus of Morgagni, from the side, there is opening of two important structures. One structure which opens is the eustachian tube, and the second structure which opens is the tensor palatine muscle. So we have the eustachian tube and the tensor palatine muscle opening through the sinus of Morgagni. Fine. So this much knowledge was important. Then we shifted to three parts, that is nasopharynx, oropharynx, and hypopharynx. Nasopharynx. Again, I come back to my friend's diagram of Dr. Vijay Govindarajan. He has very nicely drawn this diagram. Again, we see this diagram. We have nose, nasopharynx, oral cavity, oropharynx, larynx, hypopharynx, which is also called as laryngopharynx. This hypopharynx continues as esophagus and larynx continues down as trachea. And from the larynx, there is a cartilage epiglottis. So from the skull base up to the soft palate is the nasopharynx. From the soft palate up to the tip of epiglottis or the vallecula is the oropharynx. And from this up to C6 vertebrae is the hypopharynx. So nasopharynx, oropharynx, hypopharynx. In the nasopharynx, there is opening on the side. On the side, there is opening of the eustachian tube. Remember, in the nasopharynx, on the lateral part, there is opening of the eustachian tube. Just above the eustachian tube is a pyramid or a triangular shaped fossa. And this fossa is important because this fossa is called as fossa of Rosenmuller. Fossa of Rosenmuller. Importance. The importance of fossa of Rosenmuller is that this is the most common site of origin of malignancy in the nasopharynx. One more question. Last time we had discussed, what is the epithelium of the nasopharynx? What is the lining epithelium of the nasopharynx? Lining epithelium of the nasopharynx. Anybody answering? Yes. Respiratory, I want the exact name. Yes, I got the answer from Gurluk and Gopinath. Ciliated columnar, right? So it is the ciliated columnar epithelium, it is a stratified ciliated columnar epithelium, right? I'm getting the answer. So ciliated columnar epithelium is the epithelium of the nasopharynx. On the side, there is opening of the eustachian tube. Just above the eustachian tube is a triangular fossa, which is the fossa of Rosenmuller. So remember, laterally opening of eustachian tube. Now, as you go in nasopharynx, on the top is the presence of a lymphoid tissue, and this lymphoid tissue is called as the adenoid. So adenoid is present on the roof of nasopharynx. Remember, adenoid is present on the roof of nasopharynx. So in the nasopharynx, on the roof is adenoid, floor is the soft palate, and on the sides there is opening of the eustachian tube. These things are important to know. Remember, as we come to the oropharynx. So oropharynx, now we know from this diagram that oropharynx is the part which is behind the oral cavity. So as we open the mouth, what we see behind is the oral cavity. One more point. The entire pharynx, the posterior wall, is called as the posterior pharyngeal wall. So posteriorly, the entire wall is posterior pharyngeal wall. So in the oropharynx, nasopharynx, hypopharynx, the posterior part is posterior pharyngeal wall. In the oropharynx also, posteriorly, what we see is posterior pharyngeal wall. On the sides, there is presence of tonsils. These are the main tonsils which we talk when we talk of tonsillitis. These are also called as the palatine tonsil. So on the sides, there is tonsils. Posteriorly, posterior pharyngeal wall. Anteriorly is opening into oral cavity and part of base of tongue. So anteriorly will be base of tongue, on the side will be tonsils, and posteriorly will be posterior pharyngeal wall. So this is about oropharynx. Coming down is hypopharynx. Remember, hypopharynx has three parts. One part we already know, the posterior part will be posterior pharyngeal wall. There are two more parts of hypopharynx which we will discuss in detail when we take the topic of hypopharynx. However, right now just remember that hypopharynx has got three parts and all three begin with P. One we already know is the posterior pharyngeal wall. and two more. One is the pyriform fossa, and second is the post-cricoid space. I'll try to look for a diagram if he has given for this. Okay, so this is one diagram which again I am discussing. Nose, behind that is nasopharynx. In the nasopharynx, there is opening of the eustachian tube and the adenoid is present. Behind the oral cavity is the oropharynx, where we can see the tonsil. And this is larynx, behind that is hypopharynx. So nasopharynx and oropharynx. Anybody, what is the epithelium of the oropharynx and hypopharynx? Epithelium of the oropharynx and the hypopharynx. Epithelium of the oral cavity and the hypopharynx. One or two answers. Ciliated is wrong. Yes, Gopinath, right. It is stratified squamous epithelium. Do you want to add something to it? It is just stratified squamous, something else? Yes, Himani, it's non-keratinized, right? So it is stratified squamous, non-keratinized epithelium. Stratified squamous, it's a non-keratinized stratified squamous epithelium which is in the oral cavity and in the oropharynx and in the hypopharynx. Now, we are about to end this part. However, three important points. One is about when we discuss of nasopharynx, we should be aware of the adenoid. Adenoids are lymphoid tissue, same as tonsils are also lymphoid tissue. Adenoids are lymphoid tissue. Tonsils are also lymphoid tissue. Again, a MCQ, which is asked in exam. Which pharyngeal arch develops the adenoid and which pharyngeal arch develops the tonsils? Anybody wants to take a guess? Pharyngeal arch developing the adenoid, pharyngeal arch developing the tonsil. The pharyngeal arch from which adenoid develops and the pharyngeal arch from which tonsil develops. Second, both adenoid tonsil. Misha is saying it is second. Is it both adenoid tonsil from second or anything different? Okay, most of you are all saying second, which is right. It is the second pharyngeal pouch, second pharyngeal arch from which it develops. However, from the dorsal part, obviously it will develop the adenoid, and from the ventral part will develop the tonsil. So from the ventral part of second pharyngeal pouch develops the tonsil, and from the dorsal part develops the adenoid. So both of them have same derivative. The second pharyngeal pouch, however, from the dorsal part is the adenoid. Again, questions have been asked on this, and the ventral part is tonsil. And if you take out the tonsil, you will find many clefts inside that. The remnant, a lot of time there is a deep tonsillar crypt which is present, which is remnant of the second pharyngeal pouch. The remnant of second pharyngeal pouch is sometimes present in the tonsil. Now that we are discussing about pharyngeal pouch, let us just discuss one or two more questions which have been asked from pharyngeal pouch or arches. Because the moment somebody mentions the term pharyngeal arch, we all think it is something very complicated. Remember, there are 6 pharyngeal arches. 1, 2, 3, 4, 5, 6. There are 6 pharyngeal arches. The 5th one disappears from that. So total pharyngeal arches are 5 that we need to discuss. Now, pharyngeal arches are important. Pharyngeal arches are important. So they make something important structure. They make some important structure. So remember things developing from pharyngeal arches. Remember that pharyngeal arches make some important structure. So make is first pharyngeal arch, some is second pharyngeal arch, important is third pharyngeal arch, structure is fourth and the sixth pharyngeal arch. So pharyngeal arches make some important structure. Now what are these make some important structure? Remember, first is make. So first pharyngeal arch, the nerve for the first pharyngeal arch is maxillary and the mandibular. Maxillary and mandibular, so it is starting from M, and all structures from M are forming from the first pharyngeal arch, mostly the middle ear, malleus, yes, part of incus also. So malleus, incus, and maxillary nerve and the mandibular nerve are part of this, and muscles of mastication. So M, remember, make something important. So M, maxillary mandibular nerve, muscles of mastication, plus the malleus and the middle ear is formed by the first pharyngeal arch. Second pharyngeal arch, remember, make something important. So something is S. So second pharyngeal arch is supplied by S, that is seventh nerve supplies second pharyngeal arch. Second nerve supplies second pharyngeal arch, and structures of S like styloid process, stapes bone, they are formed from this second pharyngeal arch. Then comes third. Third is make something important. Important is I. I is when we write 9 in Roman. When we write 9 in Roman, it is 1 and cross. That is I and cross. So it is ninth nerve which supplies, or which is the nerve for the third pharyngeal arch. Ninth nerve which supplies the third pharyngeal arch, and also the superior process of the hyoid bone is supplied, is formed by that. Stylopharyngeus is formed by that, and then comes the fourth and sixth. The 6 plus 4 becomes 10. So 10th nerve is the nerve for the fourth also and sixth also. Superior laryngeal nerve and the recurrent laryngeal nerve. So if you try to remember this, it is quite easy which nerves are formed or which parts are formed by the pharyngeal arches. So we understood about pharynx. We should know from pharynx, we should know about the types, the parts of pharynx, what structures are present when we talk of pharynx, parts of hypopharynx, parts of oropharynx, parts of nasopharynx. And last point for today is about adenoid. That adenoid is a lymphoid tissue which is present in the nasopharynx. If the adenoid grows in size, it can occupy the entire nasopharynx and can also enter inside the nasal cavity. And this will lead to difficulty in breathing. Very common in children. Large adenoids, when the adenoids are large, the child will have difficulty in breathing, and when a child has difficulty in breathing from nose, his mouth will open. These children with enlarged adenoids have a typical face. Last topic for today is a typical face that the children with adenoid hypertrophy have. It is called as adenoid faces. So a child breathing from nose, the kind of face that he will have is adenoid faces. 4 or 5 characteristic of adenoid faces. 1, because he is not breathing from nose, it will be a pinch nose appearance. First is a pinch nose appearance. Second, he is constantly breathing from mouth, so development of maxilla is getting affected. So he will have a high arched palate. Pinch nose, there will be high arched palate. The part below the nose, which is the philtrum, the philtrum will become narrow. And fourth important thing is, because the development of maxilla is getting affected, so there is crowding of the upper incisor teeth. So pinch nose, narrow philtrum, high arched palate, crowding of the upper incisor teeth, and the child will have a long, dull, boring kind of face. So these are the characteristics of a child who is constantly breathing from mouth and who has enlarged adenoids. Confirmed by a X-ray. We do an X-ray lateral view to look for the size of adenoid. We can also put a nasal endoscope, and if it is enlarged adenoids and which is causing child to have difficulty in breathing, the child is to be taken up for adenoidectomy. So this is all that we need to discuss about pharynx. Next class, we will discuss about tonsils. Yes, somebody has written sunken eyes and mask-like face. Yes, you are right. It is dull-looking face. Sunken eyes, I am not very sure, but yes, dull-looking face, long, dull-looking face. So this was all about pharynx that we should understand. I'll revise few MCQs for interns who have joined that have been till now asked from pharynx, and whatever I can think, those questions can be asked in MCQs from pharynx. One is about the epithelium, which you have answered correctly, that the epithelium of nasopharynx is ciliated columnar, that of oropharynx, hypopharynx is stratified non-keratinized. Second MCQ was about the length of the pharynx. Third was about the nerve supply of the muscles of pharynx. All muscles supplied by pharyngeal plexus except stylopharyngeus. Fourth was about Killian dehiscence, then Ackermann's area, then sinus of Morgagni, what opens the sinus of Morgagni, then the extent of nasopharynx. Parts of hypopharynx have also been asked. All these are parts of hypopharynx. The nerves of each pharyngeal arches have been asked about this. Development of tonsil and adenoids have been asked, and all of the following are features of adenoid faces except something like this. These are the questions which have been asked from pharynx. I think that is all that we'll discuss about pharynx. It was part of revision from the previous class and something new today. Next class, we will discuss about tonsils. I hope all of you have understood this. Any doubts? I'll wait for 1 minute. You can type any doubts if you have, or else thank you so much. This, I think, video would be there on this YouTube. Anybody who has not attended, I can see around 60 people there. So anybody who has not attended can obviously see this lecture again. Thank you so much. If no questions, I will end this stream. Any questions? Next class timing, I'll message to your CR. Mostly it will be on Thursday, but I'll message to your CR because next class will be after the lockdown. So I'm not very sure how the schedule will be. Thank you so much, guys. Thank you. Take care. Stay safe. Somebody is saying I'm not from your college. It's all right. It's not important college. You need not be all from my same college. You can keep checking the YouTube site. I'm sure I'll put it 1 or 2 days in advance when the live class will be. Anybody can join. Thanks.